Hey team, it's Coach Candace RN, and today we're here to go over a Next Gen NCLEX Bowtie question. Are you ready? Let's go. All right, guys, here we go. We're going to take another look at take our first look at the standalone bow tie question. And this one accompanies the question that we recently did as part of a NCLEX Next Gen case scenario question. All right, so the little clue is our little jumping heart there so that you can get a sense of which system we're working with. All right, so we have a standalone bow tie question. And generally, that's a single question. It stands alone, which is why we call it standalone. And when you finish responding or picking your selections from this drag and drop style question, it's multiple drag and drop, you will end up with something that looks a little bit like a bow tie. That's why they call it the bow tie question. All right, so with that said, the information here you're already familiar with, Kiana. So we're just going to move through this question. The nurse's notes are that the patient has a chief complaint where it, quote, feels like an elephant is sitting on my chest. And it started 45 minutes prior to the patient's arrival. I'll just zoom in here so you can see it very well. 13:30 is when this nurse's note was made. It's pretty much a focused assessment where the patient was found to be alert and oriented, times 3. Diaphoretic, anxious, with cool, pale skin. All right, chest pain radiating to the jaw and left arm. The last void was 30 minutes ago and it was 125 milliliters. S1 and S2 sounds were auscultated without murmur. Blood labs were drawn and the lungs are clear to auscultation bilaterally. The patient denies recent emotional stress or anxiety. All right, the patient's admitted for chest pain and shortness of breath. Excuse me, patient, and his name is Thomas Bryant. He's 59 years old and has a medical history of type 2 diabetes, hyperlipidemia, smokes 1 pack per day, no known allergies, and is a full code. The meds that Mr. Bryant takes are listed here: metformin, 1,000 milligrams BID, atorvastatin, 20 milligrams PO daily, and aspirin, 81 milligrams PO daily. That's the information we have. We also have some basic vital signs information. Yes, on the NCLEX, it's possible that you'll have 2 or 3 tabs, maybe even 4 tabs, and you'll be able to toggle through those EMR tabs, although the question will remain the same, and it's usually not a whole lot of additional extra data. All right, so we got some vital signs there. We have those assessment findings, and now let's look at the question. We have our lab results, all right, as we saw before. And now let's look at the question. I'm going to zoom in here so you can see this set of instructions. They're the same every time, so just learn them by heart and you will know the bow tie question setup. I do want to say too, you only get 1 point for all 5 choices being correct. So never waste too much time on a bow tie question, because if you even get one of these wrong, you get no points. And you want to be spending your time on those partial credit questions so you can have as many partial credit points as you can rack up. Okay, so we don't want to worry about spending way too much time on these questions. All right, but they're usually very straightforward. And the instructions are to complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. You'll do that first. All right, then 2 actions the nurse should take to address that condition. So first you need to know the condition, then you'll pick the 2 actions. And then finally, 2 parameters the nurse should monitor to continue to assess the patient. Okay? So with that said, your condition most likely experiencing options are here. I'll read them aloud just in case. It's hard to see here. Left-sided heart failure, All right, gastroesophageal reflux disease or GERD. All right, ST elevation, myocardial infarction or STEMI. And then finally, pulmonary embolism. Those are your potential conditions, and you have all that data there to help you make your choice. All right, so let's first start there. Which of these conditions are we going to select? Is it left-sided heart failure, GERD, STEMI, or PE? Based on the information we,
Okay, you ready?
yep,
I think it is ST elevation, myocardial
absolute
infarction, and
infarction.
then the action to take will be,
Oh, wait,
yep,
let's see if your first one is correct. All right, we'll take it step by step. Yes, absolutely. It's an ST myocardial infarction. You are ready to go. And this is what it would look like. You clicking and dragging it up there. I got a little animation there for that. All right, and you're ready to move forward to our actions to take. So which action would you then take? We have our options to insert an nasogastric tube or an NG tube, administer aspirin and nitroglycerin, encourage PO fluids, prepare for emergent cardiac catheterization, or encourage coughing and deep breathing. Which action do you want to take?
two and
Two
four.
actions. Which one? Two. All right. So administer aspirin and nitroglycerin. Yes. All right. And then the other one, you said four, prepare for emergent cardiac catheterization. Absolutely, Kiana, that is correct. What does that look like? You're clicking and dragging those two options up into the bow tie. Excellent. All right. So what will be our parameters to monitor? Will they be no new information, but I always encourage you to go back and take a look at your tabs. Our two parameters to monitor. Our choices are bowel sounds, blood glucose, cardiac rhythm and ST changes, BP and urine output, or finally daily weights. What are our two parameters that you'd like to monitor here?
3 and 4.
3 and 4. 3 would be cardiac rhythm and ST changes. Correct. All right. And then BP and urine output. Absolutely correct, Kiana. Excellent. So we slide those up on there, click and drag, and we've completed our bow tie.